back. This morning we're speaking with Dr. Ben Emery from Aspen Ridge Dental. Thanks so much for joining us.
Thank you for having me.
All right, we've covered a lot of ground, talked about a lot of issues. What's your pleasure today?
Well, my friend Carrie and I were talking, and we talked about what would interest her, and she said oral cancer. That would give her some interest, because she's unfamiliar with that area. And so I figured we could talk a little bit about oral cancer today.
All right, tell us all about it.
So did you know that about 30,000 cases of oral cancer are diagnosed per year in the United States? And of those 30,000 cases, 6,000 to 9,000 people actually die from oral cancer every year.
That's so amazing. 6,000 to 9,000 people dying a year from oral cancer. Are a lot of these cases possibly preventable?
Yes, very preventable. The leading cause of oral cancer is actually cigarette smoking or the use of smokeless tobacco. So if you're a cigarette user, you want to make sure that you routinely go to your dentist for oral cancer exams.
That's obviously avoidable. Don't have to smoke, don't have to be using the chewing tobacco. So now what are some of the signs, preferably the early signs, that people are going to see if they think that oral cancer might be a problem for them?
Any changes?
Some pictures here too to demonstrate.
Any changes in the tissue. Now, this white lesion that's corrugated and wrinkled is actually from smokeless tobacco, chew, or dip.
You can see that appears to be some residue there.
Some remnants still there. And so this may look normal to a lot of people who use this smokeless tobacco product, but in reality, this is a more normal appearance in the tissue. This is what actually be considered precancerous. And so what you want to be concerned about is, the changes in the tissue. And when do we do a biopsy for that to make sure that there is no cancer? Because up to 17% of those kinds of lesions actually turn into be cancer.
Are they usually feeling a lot of sensitivity in that area when that's
usually no sensitivity? Yeah, but it's very, very normal. The best way to combat that is actually discontinue the use of the smokeless tobacco.
Okay.
If it goes away, then most likely it's not precancer, it's not cancerous. But if it doesn't, that's when we want to biopsy it, send it to the pathologist for a reading.
Good to know. What's going on here?
So this is the early signs of squamous cell carcinoma, which is on the lower lip, mostly caused from smoking.
Okay, will they be able to tell a big difference between this and just a cold sore?
Yes, this actually does not go away in about a 2-week time frame, which cold sores usually do. So at Aspen Ridge Dental, we believe that it's imperative to have these oral cancer exams done every time they come in for a checkup. Either the first time they come in or the 20th time they come in. Every single time we do an oral cancer exam.
And we did see some pictures. You showed us some pictures earlier of some things that maybe people didn't want to wake up to at their breakfast this morning. This can be extremely damaging and painful, I imagine.
Exactly. Sometimes it can be so severe where the entire tongue is lost, needs to be removed, the entire jawbone needs to be removed. I certainly didn't want to bring those pictures in today, but if you want to see them, I can send them over to you.
All right. So now, what do people need to be doing if they start to notice that they have some of these same symptoms or same signs that you've shown us? Is this something they need to get in immediately and see you guys about?
I would say so. The longer you wait with a lesion like that, the more chance of it becoming precancerous and turning into cancer.
There's so much research being done right now that links oral hygiene to cardiopulmonary diseases, those kinds of things. Have you been looking into a lot of that? Are there a lot of interesting links that you guys are noticing right now between just general health and oral hygiene? Yeah,
diabetes is a big one. Heart disease also. There's a lot of different things that can happen with the mouth that contribute to the overall systemic health of that person.
Got to take good care of your mouth, and if you have any questions about how your health care can be changed for your mouth there, contact Dr. Emery at Aspen Ridge Dental, and he'll help you out. Thanks so much for coming in.
Thank you.
Coming up next, meteorologist Joe Hansel will have another